So a lot of people relapse. You know, they come to treatment, either here or with us or with a inpatient program or an IOP, or see a counselor, or they just go to support meetings, and then they do okay for a while and then they start using again. And so the question is, why do people keep doing that? And I think there are sort of four big categories that I think is important for you to know about so that you can avoid relapse. The first one is that your brain hasn't healed yet. So we know that it takes probably about a year for the brain to fully heal, with all of its neurotransmitters, its dopamine getting back to normal, and all the other systems sort of getting back to normal. So anytime during that year, you're vulnerable for relapse because your brain is low on these chemicals, low on dopamine, and you know what can give you more dopamine, using drugs or alcohol, and clearly that works for a few minutes or an hour or two, but then leaves you even more depleted than before. So bottom line is you have to be super careful the first year. It's a critical time. The second one is use of any other drugs. So a lot of people think they can get off heroin and still drink alcohol, still smoke pot, still do other things. But the truth is those other drugs are releasing dopamine in the pleasure center just the same as the drug of choice did. So what have you done? You've just switched from one to another. Now, often they get away with that for a while, but it's still releasing a little dopamine, and it's still keeping their brain thinking, I want more dopamine, I want more dopamine. So we see it happen all the time. People get off heroin, they go 6 months or whatever, and they're doing fine, and then they go have a couple of drinks, and before you know it, they found someone with heroin and they've started using again. Or they're trying to get off cocaine and they have a couple of drinks, or they smoke some pot, and then before you know it, they're doing the cocaine again. It happens all the time. And so the real answer to that piece of the puzzle is be abstinent from everything. Let your brain go back to normal. Let it heal over that 12 months period. And stop putting chemicals in there that keep that flame going, if you will. Just let go of it and be fully in recovery. The third thing is memory triggers, and that's probably the most powerful cause of relapse. We know that when you get that dopamine spike from your drug of choice, that it sends messages to the memory circuits all around the brain that remind you of where the drug is, and and what you were doing and who you were with. So sights and smells. People say people, places, and things as sort of a catchy way of talking about that. And of course, this is a natural system, with our basic survival drives of food and sex. It was essential that we would remember where we got those basic needs met, and drugs overpower that. So we create these incredibly strong memories for what was going on at the time of the drug use. So to deal with that, you need to really start being aware of all the times you get a thought or a craving or any kind of thought. It might be going past an ATM machine where you got money out. It might be driving past a liquor store. It might be visiting with a friend. It's similar to people stopping smoking cigarettes. You can be off cigarettes for a year, and then you go to a party and people are smoking, so you see it. You see the people who are doing it, you smell it. Before you know it, you're thinking, maybe I should have just one cigarette. It's the same process. It's the same process with food, where you go into McDonald's and they've got a picture of a big giant chocolate sundae, and you weren't even thinking of having a sundae, but now all of a sudden that memory is triggered, like, oh man, that tastes so good. And so before you know it, you've made a decision to do it. So you've got to be careful with those things. The fourth thing is strong emotions. So we know that when people are having strong emotions, anger, sadness, fear, loneliness, even happiness and joy, that dopamine is actually being released in the pleasure center. And so that again gets your brain thinking about something else that can give you an even more strong feeling. And so we see a lot of people relapse when there's a lot of stress going on, when there's marital problems, or whether there's work problems or kid problems or any kind of problems like that. And so that's why it's important to get some therapy and counseling to learn how to deal with your emotions. It's why it's important to go to support groups like AA and NA, so that you could be around people to help you through difficult times and give you tools in order to use things that work, that are not addictive, calling friends and doing positive things and all the other things that people can do. Interestingly, a lot more people relapse, seems to me, from positive things. They often relapse when good things happen rather than when bad things are happening, because often when bad things are happening, you're kind of ready for it. My mother's got cancer or something like that, so you're kind of ready for it. And then sometimes when there's a big relief, a job, or a new relationship or something, it's like, oh man, I feel really good. I think I might have a drink. So again, you've got to pay attention to your emotions and make sure that you just keep on an even keel. So those are the 4 things. Part of recovery is about paying attention and really making sure that you willing to go to any lengths is one of the terms I like using. Where you become willing to do whatever it takes to stay clean and sober. And part of that is paying attention to these kind of things.